and we know that cancer is a large group of diseases that can start in any organ or tissue of the body, especially when abnormal cells start to grow abnormally. But have you ever thought of throat cancer? Well, we're about to learn a thing or two on the show today. So starting off, we have a survivor of throat cancer, Mary A. Fojo, here in studio. But of course, to help us understand and break what this thing is about, this whole throat cancer is about, we have Dr. Ama Boatema-Prah, and she is an otorhinolaryngologist. You thought I wasn't going to get it correct. You thought I wasn't going to get it correct. But now I got it correct. It's such a long word. But ladies, you're very, very, very welcome.
Thank you.
Doc, when we say you are an otorhinolaryngologist, what does that mean?
I'm an ENT surgeon.
ENT, no, but I'm kind of simple now. Yes. So you could have just said ENT, and you're schooling me this morning. Yes. But of course, it's great to know. Anyway, I'll come to Mary. But before we come to Mary, I mean, we know about breast cancer, cervical cancer, and other forms of cancer. Throat cancer, what causes that? What is it?
So throat cancer is basically abnormal growth of cells in your throat. Oh. And your throat is internal. That's why it's rarely talked about, because people hardly hear of it. And then your throat basically connects your mouth to your esophagus. So it helps in swallowing. And that's posterior. And then also your throat connects your nose into your airway down to your lungs. So that also helps with breathing and also your speech.
Right.
So throat cancer, usually because it's hidden more or less, it's not like breast cancer. You see that maybe one breast is bigger than the other, or cancer anywhere else that is obvious. So it's rarely spoken about, and that's a challenge to us, because patients see the symptoms late, and even most of them ignore the symptoms. So we end up getting them late. That's one big challenge.
Right.
And what causes throat cancer? It's primarily a disease for smokers. All sorts of smoking, tobacco, marijuana, and all that. And it's not just for the smokers, but we have what we call secondary smokers. So you are not holding the cigarette to smoke, but you are always in the presence of people who are smoking and taking in the smoke.
You can get it as well?
Yes, please. And then now we have shisha coming up. People think, oh, shisha is safe and all that. But shisha is also...
It's actually not that safe.
Yes, please. Yes, please.
So anything that has to do with smoke?
Yes, please.
So how about my auntie who runs a chop bar, and she's always cooking with a tripod stove, the traditional one with firewood and all that? Can that cause that too?
I mean, there is a link, not a strong link, as opposed to smoking the cigarettes. There is a link between an association of throat cancers and exposure to coal dust, wood dust, and gasoline, inhaling gasoline and all that. But we are more concerned about smokers. And aside the smoking, we have other risk factors like alcohol. Alcohol by itself, consumption of large quantities of alcohol can cause smoke cancer. And most especially doing it together with smoking, it multiplies the risk if you are smoking and taking in alcohol. Another risk that people do not want to hear us talk about is oral sex.
Jesus.
Oral sex.
You're shaking some tables this morning.
I'm shaking them. I'm breaking them.
What about it?
So yes, through oral sex, we can transmit a virus called the HPV virus, which is implicated in causing cervical cancer. So that same organism that can cause cervical cancer, if you are getting it in your throat, you can get throat cancer.
Okay. How about the consumption of very hot beverages or even normal hot water? I've got chronic sinuses, so you find me drinking a lot of hot stuff most of the time. Does it have any effect at all?
It's not known to cause.
Thank you, Jesus. Okay, we cancel that one in Jesus' mighty name. Anyway, so now you've told us what causes it, but what organ in the throat is affected by this type of cancer?
Okay, so throat cancer can affect, the commonest type is the laryngeal cancer. So your larynx is essentially your voice box. So it contains your vocal cords plus other structures that aids in breathing and swallowing. So that's the commonest site. But then we have other cancers of the throat affecting the pharynx. The pharynx actually is where, food channels through into your esophagus, the hypopharynx. So that site too is known to cause throat cancer. You can have cancer of the oropharynx, that's behind your mouth.
Okay. If we didn't have Mary here, I would have asked you about the signs and symptoms. But thank God we've got the survivor herself here in the studio. And Mary, okay, say good morning. Let me see if we can hear you.
Good morning.
Okay, so we can hear you. So you have to press that all the time when you're speaking.
Yes.
I'm going to come to what device that is. But let's go to the very beginning. When it started, how did you feel? What led you to the hospital?
Like Dr. rightly said, we know some of the signs and symptoms, so it's mapping to me.
Okay.
So I was diagnosed very advanced stage. Thank God they saved my life.
Oh.
It's a hoarseness of voice. If I say hoarseness, like we all get hoarseness, breakage of voice, that's when it started. I never took it serious, like she said.
Right.
It became part of my life. So most of my classmates used to laugh at me that that kind of.
Hold on. So the hoarseness of voice, did you used to feel funny things in your throat? Maybe you had phlegms or anything? No, not at all.
Just the hoarseness of voice.
Not when you wake up in the morning?
Sometimes, mostly when I wake up
mostly in the morning, when you wake up, you experience the hoarseness of voice. And it will last for how long in the day?
During the day, it comes on and off.
Okay.
It comes on and off during the day.
Right.
But I attributed it to stress because I'm a midwife and a baker at the same time.
Okay.
I thought I was overstressing myself, so I didn't take it serious.
Wow.
So I got up one day and I saw a large swelling, let me say swelling, on both sides of my neck.
Both left and right on your neck?
On my neck.
Okay.
Even with that, as a health worker, I thought it was infection. Or my mother was telling me it was Jemrikutu those days.
Jemrikutu, yes.
So they were asking me to put on sand and she said no stuff. I didn't take it serious. I took antibiotics for about 2 weeks. It wasn't going.
But how long did you develop the swellings after you started experiencing the hoarseness of voice?
Like 2 weeks.
Wow, in a matter of 2 weeks?
No, after the hoarseness, it took about 5 to 8 years.
Oh, when you're experiencing the hoarseness. So after 5-8 years, that's when you develop the swellings on your neck, both left and right. Okay, let's continue.
And then I reported. I did a biopsy and came out as throat cancer stage 4.
Were you frightened?
We're talking about cancer.
Jesus.
Of course. And me being a health worker, I know the stages too. So stage 4, I knew there was no hope for me. But thank be to God to that year.
But let me just ask, as a health worker, yes, you're a baker, yes, you go through stress and everything. There wasn't anything instinctive in you that said, no, this thing, it's taking too long. This hoarseness, it's been happening for some time. Let me go check it. There wasn't anything like that you felt at the time?
At the beginning stage, I went to check.
Okay.
I went to Kolemu to check, but they did thorough investigation. There was nothing found. So they gave me some medication to take, and that was all. I didn't see it necessary to go back because I went and I didn't see anything. I just decided to be there. And that's how it ended me.
Okay. But Doc mentioned that it's primarily smoking. Were you a smoker at the time?
I've never smoked.
What did you say?
In my life, smoked. I've never been among smokers.
You've never been around smokers?
Actually, I'm a church of Pentecost member. You know how we are brought up. We don't do certain things. No way.
So then, Doc, explain it.
Alcohol.
So she's telling you she doesn't smoke, she doesn't take alcohol, she doesn't even live around people who smoke. I mean, where's this coming from?
Yeah, so basically, even though there are risk factors, we get patients that we don't know how they got it, but they got it. I mean, ideally, we find throat cancers common in people aged 60 years and over.
How old are you?
40 plus.
This is so rare.
Yep.
Non-smoking, under 60,
and
still got it.
She was even diagnosed in her 30s. Yep.
Wow. So you've had this condition for over 10 years.
Yes.
Okay. let's go back. So now when you reported, and now finally it was diagnosed that it was throat cancer, what were some of the questions on your mind?
Why me? First question, why me? Because health worker, my way of life, living is not like I see others. So my first question was, why me?
Has there been any history of cancer in your family before you?
I know about breast cancer, but for the throat cancer, I think I'm the first.
Doc, so what's the correlation? Because we are told that when it comes to cancers, once there is a case in your family, then you must be careful because you could also inherit it. Is there any correlation?
We are usually concerned about head and neck cancers in the family. Okay. It may not necessarily be throat cancer. It could be cancer of your sinuses, your nose. So we inquire about that. But generally, if there is a history of cancer, any form of cancer in the family, you may be at risk of developing any type of cancer. Right. Most importantly, the type of cancer that is seen in your family.
Yeah. Yep. But it was diagnosed as stage 4. Medically, what did that mean for her?
Medically, even though it was at stage 4, it was still operable.
Okay.
We have stage 4A, we have stage 4B.
When you say operable, what do you mean? I'm sure it's a medical term. So for the layman on the streets, what does operable mean?
We can operate on her.
Okay. Okay. Yep. So even at stage 4?
Yep.
Okay.
We have stage 4B. When you get to that point, it's gone beyond the borders of operation. So in that case, we treat you palliatively. When we say that, that means we cannot operate on you to cure you. So we put in other interventions to make you comfortable.
Yeah.
Yeah, but at her stage, fortunately, we could operate on her. So we went ahead and she's had a number of operations.
But so I just want to understand the process. So immediately it was diagnosed. What was the first thing that was done?
Immediately it was diagnosed. So we discussed with her. We actually treat it is in a multidisciplinary team. Okay. So once we took the biopsy, the report came, we had to discuss it at what we call a multidisciplinary team meeting, where we have the oncologist, we have the speech and language therapist, we have the otorhinolaryngologist, then we discuss. We look at her CT scan films, look at the extent of the cancer, and we decide what procedure would be benefit. And at that meeting, that's where we decided she would benefit from surgery. Okay. So we decided on that, spoke about it with her, had her see the clinical psychologist, because it's a life-changing surgery. And then involve the dietitian, because it will affect your swallowing, so your eating habits may change. Yeah. And then she saw the speech and language therapist who offer her a voice rehabilitation after the surgery, because we are going to take out the whole voice box, so it's going to affect her speech. So we are taking your voice away, basically. Right. So there are options after that, and one of it is the device she has in there, which we'll talk about later. All right. So
before we even come to the device, of course, there'll be lifestyle changes like you have mentioned. You cannot eat certain things. You cannot even swallow certain things. Did you used to feel pain? Or when it was diagnosed, were you feeling pain in your throat already? You were not feeling anything, no pain at all. So you could still eat your fufu, your kenke, and all. Oh, see, I tell you. I love your spirit. I so love your spirit. But after diagnosis and when it was found out that it was operable and you had to adjust your lifestyle, what did you do? What did you have to do in terms of eating and drinking and all that?
It's not easy.
Charlie, I can imagine.
We have God.
Amen.
When you pray, time to help you.
He will.
That's exactly what I did. You raise your bank and your people after surgery.
Can you imagine?
You know they're going to pray on your neck, so you're not going to take anything. You have to be on liquid for some time. I still have feeling challenge even as I sit here. I'm still on feeding tube that in case I encounter any challenge, I depend on my feeding tube. It's a drastic lifetime change. Yeah. If God doesn't be on your side, depression alone can kill you.
I know.
That's why this month being the Red Cancer Awareness Month, and me being a survivor, and having the chance to get this talking aid, I'm making so much noise to tell the public that we joke with some of the signs and symptoms, but it can be deadly. Yeah. I've seen a lot of throat cancer patients who lost their lives, a lot of them, that were dying. even if you succeed with the surgery and then the treatment, life after the treatment and the surgery is
but I want to understand something. When she developed the swellings, her voice was still intact. She could still talk. Could you still talk?
Her voice was hoarse.
Oh, even though she could still talk, it was hoarse at the point.
Yeah, I want to touch on the hoarseness. So the hoarseness is typically what we would say onia fam. So most of us get it after you have an upper respiratory tract infection.
We get it all the time.
You have a cold, or you go for partying, you're shouting and all that. Then, but any hoarseness that lasts more than 2 weeks
should be reported.
So you should see an ENT surgeon. Any loss of voice or change in voice that lasts more than 2 weeks. I see people and then you tell them that, how long has your voice been like this? Oh, meneno sanity. That's how my voice. It's not normal. It's not normal. Go and get checked. It's better to get checked and be told that there is nothing there than to stay there and whatever that is going on will progress. And usually the hoarseness that comes with throat cancer, it's progressive. It's progressive. It gets worse with time. But people will keep on taking vitamin C, ginger, rintian,
self-medication, no?
Yes, we get that a lot. At least go and get checked. I mean, I tell people, we go to the mechanic with our cars how many times a year? So if you've seen something, just go get checked for us to tell you that it's nothing than for you to stay with it. And there are some other symptoms I would like to touch on briefly.
Please do.
Aside the hoarseness, some people will start developing difficulty in swallowing. Difficulty in swallowing, depending on the exact site at which the cancer is developing. Some people will have no problem with their voice, but it will be difficulty in swallowing. All of a sudden, you are eating your yam, you are eating your banku, you are eating, and now you realize that, especially if it's hard, I can't swallow unless it's very soft banku. Or some people, they can't take solids at all. It's now liquids.
Yeah.
There is something obstructing there. Get checked. Some people too is not difficulty swallowing, but pain when swallowing. You have to report that. Some people too is just the neck swelling that comes. It's not just pompokeke. Let's get
Go
it
and
checked.
check it.
And some people too, the only symptom they'll feel is ear pain by way of innervation. When I say innervation, nerve supply to the ear, you can have a problem in your throat and it will transfer pain to your ear. So it's not all ear pain that you walk to the pharmacy, give me eardrops. Whether it is water that is in the eardrops, whether it's antibiotic that's in the eardrop. No, get it checked. It may not be from your ear. It may be from your throat.
Okay. Mary, so after surgery, the very first one, how many surgeries have you had so far?
14.
What did you say?
14.
14?
Yes.
14 surgeries?
Yes.
I was supposed to go for another one in January. But thanks be to God. I'll be favored.
Amen. But why 14? Is that the treatment?
Well, we had challenges with her along the line.
Okay.
And I mean, if you had seen her some 1 year or 2 years ago, you won't say this is her. So she came, the first one, we took the biopsy. We had the first major surgery for her. And we were trying to conserve her voice, so we took parts of the voice box, not everything.
Okay.
But unfortunately, that didn't help, so we had to go back and take the whole thing out. Then along the line, she developed certain complications. She couldn't eat through here, so we had to send her and put a tube direct. So as she's sitting here, she has a tube that is directly to her stomach, which she feeds through.
Okay.
And then we had to send her several times to try and open her throat so that she can eat through her mouth, even though she was eating through her tube. You would like to taste your banku.
Yes, of course.
You would like to taste. So she couldn't eat through her mouth for about a year.
So hold on. Describe to us how, in what form was the food? If it was now going through the tube, was it liquid?
Liquid.
So describe to me, what was it? Soups with fish, blended. Describe it to us.
Blended. Everything, but I was preparing mine with bones. Cow bones.
With bones.
So that you aid me in getting some calcium. Everything blended, food, everything.
Okay. At what point did she need this device, and what is it even called?
Okay, so she has what we call the voice prosthesis. After we take out your voice box, you can use it anytime after 6 weeks. We put it there to help to help in your speech. She got it after about 6 weeks, and we put it there. But we had to deal with the complications.
6 weeks after the first surgery?
That was the third surgery, right?
Okay.
Yeah. So we put that there. But what she has around it is like her artificial nose. It's her artificial, because as she's sitting here currently...
she's not breathing through her nose?
No. She's not breathing through her nose.
Wow.
So she's breathing
through her neck. So she's breathing through her neck?
Yes, please.
So where is the breath going out or coming in from? The white patch, the white substance, or the bigger, rounder patch?
So she has an opening in there, so she can open it. Oh. So this, you see what we call her trachea, and that leads you directly into her lungs. So that is where...
So I see a tube in there.
So the tube that is going behind there, that is the small one. That is the voice prosthesis.
Okay.
That is the voice prosthesis.
Wow.
Yes.
And this device, must it be sanitized? Must it be cleaned? Must it be changed? Tell me how it operates. What do you do?
I clean it morning and evening.
You clean it yourself,
yes.
morning and evening.
That's because I'm a health worker.
So you know exactly what to do.
That is what is keeping me safe.
But we do train people who are not health workers. So all our patients who have this, we train them. They see the speech and language therapists. They go through sessions with them on how to care for these devices.
So I call myself a neck briefer.
Okay.
And I have this band on my hand indicating that anytime I collapse anywhere, you can't put oxygen on my nose.
It won't work.
Yeah. So oxygen must be given through my neck.
Okay. So that's why you have this band. So this band must be on you 24 hours a day. You cannot take it off. Okay.
Take it off.
If we can zoom in, because this is some public education, I would have never ever known that this even meant anything. No, keep it on your wrist. I'm sure we'll zoom in to see it. So anytime you see, what's written on the band?
Neck breather.
Neck breather. That's what's written on it. Oh, so God forbid, just in case she collapses anywhere, you cannot do the normal resuscitation. You would have to do it through here. But I'm sure it would take a clinical person to do it, because the layman would not be able to administer anything to her.
Yeah.
I see. Yeah. How long did you say you've had this condition?
26.
Today's 24th.
Tomorrow will be 3 years.
Tomorrow. No, after surgery. After the 14th surgery. Yay! I love your spirit. Yeah. Congratulations on your survival. But tell me, in talking, is it stressful for you when you're talking?
I think sometimes it depends. You can't talk and eat at the same time.
Okay.
You can't talk and breathe at the same time.
Hey, this is stressful.
So
wait. You can't talk and eat at the same time, and you can't talk and breathe at the same time. So you have to choose which is important at any particular point in time.
So I pray to talk. As I'm talking, I'm not breathing.
Oh.
I release to take in air.
Okay.
That's why I call it entrusted life change.
Wow.
To take risks to be in the States.
Right.
So I'm more concerned of the advocacy, because I don't want people to get to my stage. You may not succeed.
Right.
And even if you succeed, depression can kill you.
I know.
So you don't want people to get to the stage. And detection save lives.
Okay. So when you started talking, there's this faint sound that is coming out now. Is it because you're talking faster, you're talking a lot more? Oh, so it means I have to be lenient on you when we're having conversations. We would have to speak one at a time. So that's here on the screen right now. Okay. Are you able to eat through your mouth now?
Yes, I do.
So what do you eat? Tell me.
I eat everything I eat.
Can you eat pepper?
Not too much.
So in moderation, just a little bit.
To make me cough. So I don't eat much pepper.
Okay.
Or anything like raw do. I cut down those things.
Okay.
I eat one at a time, swallow one at a time. I can't chug a lot of food in my mouth. I don't have to be choked.
Okay.
And if I get choked,
trouble.
And
you remember that you have to eat for a second and breathe for a second, because you can't eat and breathe at the same time.
No, you can't eat and talk.
Okay.
So if I'm eating, give me a phone call, I can't talk.
I'm so proud of you, Mary. This is not it's not a joke to go through at all, but let's take a look. I think this is another patient on our screens.
That's her.
Oh, this is her.
That's her.
She looks so different. Oh, so you were right about it, that if I had seen her a year ago, I wouldn't have noticed. So what was happening? What's happening here? What are you doing here?
Feeding.
I was feeding. That was my breakfast.
Oh, so is that cocoa or tea or something?
Yeah, that was cocoa.
This is cocoa. So it had milk and sugar and everything else in it?
Yeah, this one was no sugar.
So this was after number which surgery?
Do you remember?
Do you remember?
I think the third one.
After the third one. So you fed this way for how long? Through the tube for how long? For 1 year. What could you feed through the tube? Only cocoa at the time?
Oh, no, soups.
Okay.
Gravies.
Right.
I just looking like that's my daddy.
Oh, that's your dad. Tell me about your family support that you got in this period for over 10 years. Tell me about the family, how they took this, first of all, and how they've helped you to survive.
To God, I have a strong and supportive family. I thank God for that. My husband left me along the line.
You know what? I need you to take a breather. Please breathe for me, because I can tell that there's a lot more strain on the little device that she has. If we can get tissue as well, because I think she needs to clean up, right? So if we can get tissue, that would be helpful. But Doc, coming back to you, so this is the treatment that she's gone through and everything. And this month, or this week, is it this month? Okay. Month. So it's head and neck cancer awareness. Please talk to us. Many people are watching this morning. This is some serious education that most of us had no idea of at all. Talk to us, Doc.
So head and neck cancers, the commonest types we have is what she had. That's the cancer of the larynx or the voice box. You can also have cancer of the hypopharynx and of the oral cavity, as in the back of the mouth. And also even we have cancer at the mouth. In fact, any part of your head and neck, you can have cancer. You can have of your parotid, you can have of your nose or your sinuses and all. But we are concentrating on throat cancer now, today, because it forms the majority of the head and neck cancers that we see. We've gone through the symptoms. So hoarseness, any hoarseness more than 2 weeks is not normal. Get it checked. And then if you're having any difficulty swallowing, be food, water, if it's difficult or if it's painful, you have to report. Or if you cough upon swallowing, that also you have to report. Or you're having repeated sore throats. Every time I have sore throat, that is my normal, It's
not normal.
Please, get it checked.
Dr. Amma.
There are treatment options. We've had sad moments when patients come at an early age. You tell them, you know what? We've examined you. We think there is an abnormal growth in your throat, but we need to send you to theater to take a bite, to take a biopsy, so that we'll know, is it cancer or not? There are other swellings that can happen in your throat that may not be cancerous, that the treatment is different. So we need to send you to theater to see if it's cancer or not. Then they run away. The next time they come, they can't breathe. Because as the cancer grows, you wouldn't be able to breathe.
Thank you for the education this morning. Which hospitals can we go to? Any hospital here in Ghana? I know Korle Bu, that's where you're coming from.
That's where I'm coming from.
Okay. But where else?
Preferably any hospital with an ENT surgeon. We know we are not a lot. We are trying. We are not a lot. We are in Accra here, Korle Bu, you get an ENT surgeon, 37, Ridge Hospital. A number of the private hospitals also have the services of ENT surgeons. Outside Accra, Kumasi they do, Ho they do. A number of the regions, we are now coming up. We are trying, but we will get there someday. We are not a lot.
We are grateful for your time this morning. Thank you. It's been so much education that most of us had no idea about, but thank you so much for coming. And Mary, we are happy about your survival. I thank God for your life, and thank God that the January surgery has been cancelled. God has come through for you, and we pray for you that it will stay like this for a very, very long time. Congratulations. have a healthy life ahead. Well, Dr. Ama Boatimapra, she's a medical doctor at Kolebu, and she's an otorhinolaryngologist. And Mary A. Fojo, she is a throat cancer survivor. She's brought us a lot of joy this morning. There's still hope, but make sure that if your hoarseness in the voice lasts for more than 2 weeks, please make sure that you have it checked out. Thank you so much.